Hi class. As I promised, here is the follow-up video to demonstrate the starting an IV skill. The checklist that you were distributed last night, which will be posted online, we're going to go over each of those steps. But first I wanted to discuss the parts of the tools that you will need in order to do this skill. If you look here in front, this device is actually called the IV catheter extension set. You have this in your skills lab kit, the IV start kit in your skills bag, or kit rather, but what you actually have, which is not something that I have, is a device that's attached to it. So what you're looking at right here is actually an injection site. Okay, that is what I'm going to be using to complete this IV catheter extension set. Okay, that is this. Here we have, I'm using a 20 gauge. Do you remember the 20 gauge IV catheter that we're going to be using to actually pierce the skin? Remember, this is actually the skin. These are the vessels, okay, that we can see that we're ultimately trying to cannulate. We're trying to cannulate these vessels, okay, to establish an IV site. We have 2 flushes of 10 cc's of normal saline, and then you have your IV start kit, which here has your tourniquet, it has tape, it has a gauze pad, it has an adhesive bandage that you will use. In some cases you'll get a brand called Tegaderm supplied by the vendor to your hospital, and there's also a label system in here, plus gloves. This is what we're going to be, this is what you guys have. I have gloves. You need clean gloves. This is not a sterile procedure. Even though you're piercing skin, it's not a sterile procedure, it's clean. You also have here a pad, because putting in an IV line can get pretty bloody. You'll have blood that ends up on the patient's blankets, sheets, on the floor, on you if you're not careful. So you want absorbent surfaces to allow you to catch and collect the blood if some does happen to spill. There is also, before you set any of this up, most likely you're going to use the patient's bedside table. So you will want that surface to be cleaned before you put any of your supplies down onto it. So you'll put on clean gloves. You'll put on clean gloves, and you will wipe down that surface before you put any of these tools at the bedside. Does that make sense? Okay, step 1, identify the client with 2 forms of ID. Not just asking Mr. Teddy Bear if in fact he is Teddy Bear. Remember that. You need to look at the ID band, and you're looking for date of birth, you're looking for medical record number, any additional identifiers, because putting in an IV on a patient or a client is serious business. Yeah. Once you complete your hand sanitizing, then you need to put on clean gloves. Because what you're going to be doing is you're going to clean your surface before you put everything onto this area where you're going to actually start your IV on the client. Okay? Gloves. There. Ready? Next, in step 3, place a waterproof pad under the client's arm, because as I mentioned before, putting in an IV can get bloody and messy and bloody. Sorry. So you place the client's arm, and at this point in time you're looking to see where there are suitable veins. Just sort of map the area. Do you see them in the hand? Do you see them in the anticube? You're looking and surveying the arm. Ultimately, what you're looking to do is to find an appropriate vein with which you will be able to cannulate, okay, with the IV catheter. Step 4 is to select an appropriate IV device, okay, which you'll be using to cannulate the vein. And then you also need your IV start kit, alright, because you need your tourniquet, your tape, and your gauze, and your dressing, and you need your clean gloves that'll come in that packet. Plus you need your IV extension tubing, okay, which is going to be all in one package for you guys. You'll also will need your normal saline. Okay, these are the things that you're going to need to prepare to put in an IV device. So here I'm going to show you how you assemble all of these pieces. Everything is inside another container instead of the wrapper. So you take off, you remove the wrappers for all the things that you need. Okay, in this instance, here's an extra piece. Now the gloves are no longer on because once I cleaned the surface, I took off the gloves and I did hand hygiene again. Now I'm ready to work with the supplies in this clear area. Okay, so let's open up this extension tubing. Need the normal saline flush. We need our IV start kit supplies. Okay, we pull out our gloves. We pull out our dressing, our gauze, our tourniquet, our tape, and this is actually our cleaner. Now the surface that you want, you'd be putting a waterproof pad here, and you can put all these things on that clean surface if you just opened up and unfolded a waterproof pad. If, however, you're having to use say a sheet or a pillowcase, something, since there might be a shortage of that kind of tool, well then you guys have to improvise. Okay, just make sure it's a clean surface. So I need to attach the things that I need to in order to make this work. You guys have one in your kit that's already attached. Oops. You have one in your kit that's already attached. So because this comes out of the packaging sterile, you can work it as such. Okay, with your saline, okay, you uncap this and you attach this here. Then you have to prime this. Remember how we did the the IV administration, where you primed the IV tubing? So you're doing the same thing. Notice how it went through to the tip. It might drop out a bit over here. Okay, that has now been primed. You clamp this, and this is good to be set aside. Okay, so step 5 is where you're going to select a vein on the client's non-dominant arm. What that means is if somebody likes to eat with their right, they like to write with their right, if they like to comb their hair, brush their teeth with their right hand, try and go into their left. If, however, one arm is taken out of potential use because of a disease process, potentially if someone has an AV fistula, or if someone has a graft for dialysis, or if someone has had a mastectomy and has had lymph nodes removed and there's edema in the arm, well, that arm is automatically going to be out of play. So then you're going to have to sometimes get stuck with the dominant hand. Okay, it's all right to do that. But in this case, we're looking for the non-dominant hand. And that's where we're going to now begin by applying a tourniquet. Okay, if you remember, we discussed what the use of a tourniquet is. Okay, the tourniquet is to help restrict blood flow, blood return, actually venous return, from the distal portion back to the heart. So if this was, a tourniquet was placed here, well, the arterial flow coming to the extremity, which are, the arteries are deeper and they're bigger, it's not going to be as impaired as much as the venous return. So what you're trying to do is to restrict the venous return in the veins so that the veins actually fill up and plump up, so you'll be able to better cannulate the IV vein that you, or rather the vein that you've selected. So one of the important points in tying a tourniquet is you can't tie it in a bow. You need to create some kind of tension, and you need to not tie it where you do a shoelace. You don't want to do this because this makes it hard for a one-hand release. It kind of gets tough. What you want to do is tie it in a manner that's going to allow you a one-hand quick release. And so you circle the arm with the tourniquet, pulling one end tightly over the other, and then looped one end under and just pulled till you had a loop form. This way, if you want to release it with one hand, you can. Okay, that is the point of step number 5. Now, while you're doing this and going into step number 6, you're looking for a superficial, easily palpated vein. Okay, you're looking for one that's distended so that you can easily access it with your catheter. The next step in 7 is to actually pick the vein once you've looked at everything. But before that, while you're looking, the other part in step 6 is to ask the client to open and close their fist a couple of times, because by engaging the muscles in the hand, arterial blood flow is going to increase, which means venous return, the backup here with the tourniquet being tied, is going to allow for a further dilation and pulling up of the vessels, plumping up of the vessels. So back to here, you select which size IV catheter you're going to use. In this instance, I chose a 20 gauge. Okay. Remember, we talked about bevel up. When I open this up, if you guys can see, when you insert it, you're going with the bevel, the chiseled bevel up, facing up. Now we're going to have to put on clean gloves. So we'll go to the clean gloves. Now, you should move a bit quicker than this because someone's arm is tied up, right? So you don't want to keep it, you don't want to have it be a problem of circulation being cut off. So here we have the clean gloves. Remember, these are not sterile, they're clean. And now you're going to clean the site that you're choosing to go into with an antiseptic solution. Now the antiseptic solution might be something like this called ChlorPrep. Okay, it's a brand name. It is a device that if you crack it in the middle here, okay, the fluid in here will ultimately fill up the gauze, or the gauze will soak it up, in which case you will have a means to cleanse your site where you're going to go in. Okay? Say here, this is where you want to go. Now, if you do not have this kind of a device in your IV start kit, you can use regular old alcohol pads. Okay? The point being to cleanse the site. You want to protect it once it's been cleaned from touching it too often. Okay, so let it dry for about 30 seconds and don't touch the site, okay, after you've prepped it. Now what you're going to do is place the thumb. You're going to place your thumb, now we're going to pretend we move this up, you're going to place your thumb distal, far away from, distal is away from the heart, and you're going to try and press down on it to straighten out the vein. Once you do that, you're going to have to pull the skin away in order to do this. Now let me demonstrate on my hand. In the hand you'll see many, many veins. Sometimes they roll, okay, which is why you want to stabilize it and create a straight line in order to access it. Okay? You see here the exploded view, if you will, of the IV catheter. This is actually the catheter that stays in the vein. If you wanted a different angle on it, this would be sitting inside the vein. Okay? The needle helps to place it, okay? Because of its sharpness, it allows you to pierce the skin and to access it. Okay? Once you have successfully accessed the vein, this is where you push off, okay? And this will pull back the needle, okay? Where it looks like this, ultimately, when it's fully retracted. So now what you are left with is this catheter, okay, this pink part being out of the skin, and the rest of the white part is going to be laying in flush against the vein inside. And this is what fluids are going to be coming through, which is why you need that extension tubing piece, because the extension tubing piece gets twisted on here, okay? And then this is your external access, but this is your pink hub that stays above the skin. Alright, so it's going to be sort of in here, this above the skin, and this attached to it. Your dressing comes into play as being placed over here. Okay, it's the clear part that belongs to this. I hope that helps with the understanding of what to do. When you retract the needle as you're pulling it out, right, because it's in there and it's pierced the skin, now you're pushing the pink part off and it's withdrawing the needle. Okay, then you push the pink part off, this stays there, and the needle gets retracted and a spring is sprung to keep it safe like that. As I was saying, you want to hold your non-dominant thumb pulling the skin forward in order to straighten out the vein that you're going to try and access. You don't want stuff to touch it. Normally you'd tie the tourniquet a bit higher up on the arm and it wouldn't be so close to the insertion site. But say I've chosen to go in over here. Okay, my aim then is to approach this, okay, with the catheter bevel up. Catheter bevel up, you're going to go in at a 30-degree angle, okay, and your aim is to pierce it. And as soon as you get into the vein, what you're going to find is that you're going to get flashback. That is what step 11 refers to. Okay, step 10 was how you angle it in, okay, and insert. 11 is when a flashback of blood is seen, lowered the angle of the needle to be more flush with the skin. What that means is you're going to lower your needle and you're going to advance it further. Okay? Now, as the catheter is stabilized, as you're pushing it in, you want to pull this back. This retracts the needle. Okay, this is retracting it. And you're going to pull it away from the pink hub. Okay? The needle is now in here. And if you recall, now that this is clicked, let's see. Did I miss that? I didn't mean to pull it in. Oh well. I'll fudge through this later. Okay, we're going to do that again. Bevel up as you go in at a 30-degree angle, and when you get that flashback of blood, then you lower the angle that you go in and you advance the catheter. Now the needle is actually what's helping. So I'm going to pull the needle out just so I can show you what the needle looks like. Okay? This is actually the needle, okay? This is the needle that's inside here, which helps pierce the skin and place the IV catheter. So that once you have the catheter in, you can retract the needle out by doing that release motion that I was showing you. It's going to do this, okay? That's what's going to happen. So this tip here, this tip is what actually pulls the needle back, okay? So once you advance this forward, the needle gets pulled back and it'll click and you'll be out. Now what's important here is that as soon as you access a vein, you're going to get blood coming out. So you need to apply pressure above where the catheter is. Now this will normally, when you advance it, this will be inserted further, but you still want to hold on to this. Okay, so let me show you that again. Let me grab this out and show you that again.
That's off camera.
Sorry. So once again, you go in you hold with your non-dominant thumb, you hold that vein and you stabilize it. Okay, let's do this here. And you're going in at a 30-degree angle. And once you pierce the vein and you get flash in here, then you push this barrel here forward while you're pushing in to retract the needle. Okay, and you need to separate this part from the pink. Okay, see the needle comes out, this stays in here. But this blood is going to start to trickle out, so you have to quickly clamp down above here. And then what you're going to do at this point is you're going to attach. Okay, let me just show you. If I leave it out like this, as I said, you're going to have blood flowing out of here. You need to clamp this down, and you need to cap it with that IV extension kit. So with the one hand, you pull off this end. Now it's not going to work. Okay, while you're holding this, now the guy's forearm or teddy bear's forearm is going to be at this point blue if you're not careful. Once you cap this, take off this, remove this tourniquet. Should be the one hand release. This is now where you have to check and see if you're in the right place. You may have gotten flashback, but you may have actually pierced through the vein. If you recall, you only want, when there's pressure being built up because the tourniquet is here, blood flow, venous return, it's going to start to back up, and that's where you get the plump vein. Well, when you pierce the vein, blood is going to go against the path of least resistance, and so there's an opening in the vein, it's going to flow out. It's going to flow up to here, but there's an automatic pressure being applied by this clamp here, so the blood's not going to go anywhere else. However, if you pierce through the vessel one side and then out the other, you're going to develop a hematoma here, and it's just going to go and swell up. So you want to make sure that you do not pierce through the vein, but you actually pierce it and then lay it flat, and you actually enter it into the vein and lay it flat for it to just facilitate IV meds and IV fluids. So now let's see if we're in. We're going to uncap this or unclamp this, and let's see if we actually are in the right place. You see fluid coming out? Okay, we're in. That means we're in. That's great. So you clamp this end here. Okay, and you want to stabilize this, so maybe before we even do that, you want to use this so you don't lose what you've earned, what you've gained here in access. You don't want to lose it. You take your tegaderm, and what you want to do is cover the pink hub here right up until this clear twist tie part or twist attach part. So it's going to look like this. Okay, right up to the edge. This tegaderm dressing is sterile, so applying it here over the insertion site is fine. Step 14 of your checkoff basically says that you can put tape not on the insertion site, but we're going to skip step 14. You're just going to go straight to a tegaderm. And once you apply that tegaderm and you remove the borders of it, this is not as pretty as I would like it to be. Then once you've stabilized it, you can clamp this and unclamp the normal saline, and you can actually use, whoops, this is why you want to be very careful about this attachment here. This would have been, he would have been oozing out all over the place. Alright, now you would use the tape to secure the rest of the tubing. So you would do it here, put a piece here, you apply another one here, and that way you at least have it secured, and then you can get a lot fancier with how you want to loop this. Okay? In fact, which way do you, this is actually what it would look like, because remember, when you insert an IV, you're always inserting it towards the heart. You're inserting it into the direction of where the blood flow returns to the heart. I hope that makes sense. The last piece is your label, which you would, on this, write your initials, the date, and the gauge of the IV. Now, even though it's pink, and pink correlates with 20, just for good measure, actually write it over here. And then once you do that, you have your little label, and you place it near your, not over the insertion site. You want to be able to check and see if there's any IV site complications from IV therapy occur. Redness, swelling. That's why you want it clear and open and visible. I think that's already. Oh, you might wonder why this is important. Well, when we were first inserting the catheter in here, and you're busy holding this line here, you can put this under here to help catch any blood. I hope that makes sense. Oh, that's your eye. So step 2, perform hand hygiene. You're going to actually have, the opportunity to use hand sanitizer because it's there. No, that's it's aloe.
Oh, okay, whatever. You want to do it? Just keep going. We'll edit right there.